Want to avoid this because of this? Let's chat about your meniscus injury today. Welcome back to the channel. It's Dr. Arash here to talk all things about the meniscus and, more importantly, how you can take care of that discomfort you're currently dealing with. Let's first understand what the meniscus is. The meniscus is a C-shaped tissue between your femur, your thigh bone, and your tibia, the shin bone. This tissue is made up of water, collagen, protein, and other cellular elements. Its main role is to serve as a means of force transmission, shock absorption, and stability to the knee joint. How do we know if we have a meniscus injury? We have a test for you today. To perform this test, get set up in a standing position near a counter or an object for balance. Stand on one leg and bend the knee slightly, shooting for about 20 degrees of knee flexion. That's knee bending. From here, use your fingertips to rotate yourself from one side to the other. You're gonna perform 3 reps each direction. If you have a reproduction of symptoms, this test has been shown to have a 94% accuracy rating in detecting medial meniscus tears and a 96% accuracy rating in detecting lateral meniscus tears. I'd recommend starting this with your non-injured leg to get a baseline. A common question we get is, do all meniscus injuries need surgery? The answer is no. All meniscus tears do not require surgery. Surgery is indicated if you have mechanical symptoms such as catching, locking, or clicking. Otherwise, you should try conservative management first. This includes NSAIDs such as anti-inflammatories, physical therapy, and finally, injections. If looking to get started on your journey towards conservative care for a meniscus injury, we will break down the rehab process into early, middle, and late stage so that you can seamlessly progress towards whatever it is that you want to do. In the early stages, you want to focus on building range of motion and activation of muscles surrounding the knee. Make sure you have full flexion and extension of your knee, which means that you can straighten and bend the knee similar to the opposite side. Here I start out with a single knee to chest with a knee flexion or knee bending emphasis. The closer you move your hand towards the ankle, the closer you'll be able to bring your heel towards your butt. If this continues to irritate your knee, you have the option of placing a towel just behind your knee, which oftentimes provides some relief. Next, progress into actively working on knee flexion with this exercise. This will target the muscles on the back of your knee, like the hamstrings. After working on knee flexion, let's go into knee extension, which is straightening the knee. Here I work on providing a little bit of overpressure. Now, when I put pressure into my knee, I push perpendicularly. I don't just push down, I push back a little bit as well to maximize straightening the knee. After passively stretching, it's important to engage the muscles that will straighten your knee, being the quads. Here's an exercise called the terminal knee extension. Perform all these movements for about 30 to 60 seconds. Since the intensity is really low, frequency can be fairly high. I suggest performing these movements for 1 to 3 times per day. Let's move on to middle stage rehab, where we progress towards building up the strength of the ankles, knees, and the hips. We'll start with the air squat. If this bothers your knees, you can either go through less range of motion or put more weight into your heels instead of your forefeet. This will bias your hips a bit more than your knees. However, if your knees can tolerate it, continue to load into the forefeet. That way you can build up the quads and the knees. Progress to a split squat, where most of your weight will be placed on that front leg. Next, let's go into building up your hamstrings while challenging single leg balance with the single leg RDL. Progress with using a load and going through full range of motion. Now let's target the outer hip muscles with a side plank on your knees. With this exercise, you can progress to a full side plank, and if you want to further challenge yourself, you can lift that top leg up. Next, let's strengthen the opposite side of the hips. That's the groin or the adductors. Here we perform a Copenhagen plank on the knees. Perform these slow and controlled. Once you feel comfortable, progress to a full Copenhagen plank. Don't forget about the calves. Here I perform a bilateral heel raise. Eventually, I'll progress towards a single leg heel raise as I feel more comfortable. With these exercises, we would suggest 2 rounds of 30 seconds. Take your time with middle stage rehab. This is where most of the time is going to be spent. Make sure you get strong before we go into late stage. Thanks for sticking with me this far. Now that you've built up your strength, let's go into some plyometric exercises in late stage rehab. This will prepare you for high level movements or sport demands. Here we begin with a double leg jump in place. Begin with going at 50% of your effort, working towards going all out. Next, let's go into a lateral bound, which is a great way to progress into single leg movements. Let's finish this up with single leg hops, which are much more challenging than they look. Perform these exercises for 3 rounds of 6 to 8 repetitions. There's lots that can be done to help you get back after an acute or a chronic meniscus injury. If you're wanting to take out the guesswork, we've created a Meniscus Rehab Program, which is one of the many programs we have in our app. Check it out right here. Hopefully you feel confident with taking care of your meniscus injury. If you have any questions or suggestions with what future videos we should create, drop it down below. Until next time, Prehab.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.